yours.
Thank you for having me. If I had thought 10 years ago that I would be giving a talk about medical marijuana, I would not have believed it. And I definitely would not have believed that I'd be doing this in my home on Zoom, whatever that would be called, right? So this is, thank you again for so much for having me. I've been in Jefferson for 15 years and mostly seeing patients with migraine and other headaches. It's a great experience. I've been so fortunate to do this, and it's a really great career if you have a chance to do it. And I'm so happy to be here talking with you all. So I'm going to talk a little bit about medical marijuana. I believe I'm sharing the screen, right? Okay, I can make sure that I'm good there. All right, okay, good. So we're going to talk a little bit about why on earth would we recommend considering medical marijuana or cannabis for patients with migraine or other headache. What should you know about it? What kind of forms of medical marijuana or cannabis are available, and why would we ever consider it? When would we consider it? And does it actually work for patients with migraine? So we're going to talk a little bit about this, and there's a lot of changes, but I'm going to go over some of the basics. I'm going to be using the term cannabis and marijuana somewhat interchangeably, but it's important to know that when you think about marijuana that people use recreationally, you're talking about the cannabis flowers, the stems, the leaves of the female plant, and that is the part is more psychoactive. And of course, there's hemp, which is more from seeds and the fibers of the plant. And that is does not have psychoactive properties, is mostly CBD. CBD, THC, you might have heard of these terms. So THC, or tetrahydrocannabinol, is the psychoactive form, and CBD is not psychoactive. So when you see CBD oils in your sort of a health food store, they're not psychoactive. They're not regulated in the same way. They're not something that you have to buy in a dispensary. Both do act on cannabinoid receptors, but the THC is much stronger. And then adding CBD with THC can actually alter how effective or strong or potent the compound is. So THC, which is the psychoactive form, there are a number of medical conditions for which it really does work, and it's been proven to work. So nausea and vomiting, especially in patients who are undergoing things like chemotherapy, it's very effective for that. Appetite loss in patients with advanced cancer or HIV/AIDS. In chronic pain, reducing the amount or need for opioids. There's good evidence for that. Spasticity in medical disorders such as multiple sclerosis. So there are things where it's actually very proven that THC compounds do work. There's a whole host of other disorders for which there's not great evidence. Again, it's hard to do clinical trials, being that marijuana is still considered a Schedule I drug. So there's a lot of things that have been reported for it to be helpful. So spinal cord injury pain, Tourette syndrome, glaucoma, Crohn's disease. A lot of these things are not, necessarily proven where it's proven to work, but it does help to manage symptoms in many of these disorders, at least anecdotally. Again, not a lot of large studies like you would get with a drug, but some sense that it can be helpful in many other disorders. On the other hand, CBD, while it doesn't have some of those same risks, so there's no craving or addiction issues really to be seen with CBD, and it doesn't convert to THC if you take a lot of it, there's not as much benefit known for pain disorders. But I will say that there have been, it is now actually, there's a product available now that is FDA approved for the treatment of certain types of epilepsy disorders. And it may also be helpful on a more chronic basis for other neurological disorders such as schizophrenia. There's no evidence for CBD alone products in the treatment of chronic pain or acute pain. So, and often people, when they buy these over-the-counter CBD products, the dose in these products is very low, and it's really not likely to make a big difference. So I usually, when people ask me about CBD alone products that they buy, I usually tell people to save their money and use it for other things other than the CBD. Sometimes people say, I have the CBD ointment is, I like it. I put it on when I have migraine on my scalp, this ointment or cream. And sometimes you'll see that there's lavender or eucalyptus in those products. And I'll often wonder if it's the eucalyptus that helps and not the actual CBD in the product. Um, if you've ever been to a dispensary or known people use medical marijuana, there's also different types of leaves. So there's the sativa brand. So sativa is actually less sedating. And indica, I think of I for insomnia. So if you have insomnia, maybe indica would be better. Tends to be more sedating. So not marijuana may or may not be sedating for patients. It also depends on a lot of other factors and the flower, the terpenes that are involved. So it can be kind of complicated for some patients. Cannabis works, marijuana works because we have receptors in our body for it. Just like we have opioid receptors in our body for things like where opioids work, we have receptors for cannabinoids, and there's two of them we know of. One, the CB1, is more abundant in the brain, and the other one, CB2, is mostly outside the brain, but it may have a role in chronic pain. And these endocannabinoids, these in our body, these natural cannabinoids, they're not so much that they act themselves, but they're really involved in our body's homeostasis in the brain and our skin and our stomach, our liver. So that, and the effects of the cannabinoids are actually not that much different than medications people use for pain. So these COX-2 inhibitors. So there's a drug called Celebrex or celecoxib. There was an older drug called Vioxx. And the way that medical marijuana may work for pain may be similar to medications like ibuprofen, naproxen, and most similarly things like the Celebrex or Vioxx that some of you may have used before. And in most cases, better safety for regular use. So taking ibuprofen every day, that has a lot of risks. You get your kidneys and your stomach and ulcers. So again, some of the same pain benefits potentially, but without some of the side effects to worry about with long-term use. And in the future, it makes sense that in the future, rather than using something like a plant, like marijuana plant, you could consider pharmaceutical interventions that promote the release of your own body's endocannabinoids or prevent them from being broken down in your liver so that you would get better pain relief that way. So this is kind of looking in the future. We may be approaching this very differently. In terms of side effects, there are some side effects that I do tell people about. Most people feel relaxed. They can actually have a sense of well-being, but some people do have, especially with higher doses, anxiety or dysphoria, feeling off with medical marijuana, with any kind of marijuana. Obviously, it does have cognitive effects when you're using it. It's controversial if the cognitive effects, it does not seem to cause any chronic cognitive effects in older patients, even over 25 or 30. It's a question about younger patients. What about young kids who use medical marijuana? And some people feel like, well, the kids that are straight A students don't use marijuana, and that's why they don't seem to have, they seem to have more problems. So that's somewhat controversial about young kids and marijuana. Marijuana also has a side effect of improving taste and appeal of foods. And interestingly, unlike the patients with HIV, AIDS, or cancer, where they may, maintain weight or gain weight even with marijuana, I have not found this to be the case. It enhances the appeal of other foods too. So you might find, oh, the broccoli tastes really good. Oh, so I've actually not found that my patients using medical marijuana have had weight gain as a side effect. But it can increase your heart rate. You can get dizzy with it. And at higher doses, if you overdose on marijuana, and actually can cause nausea, there's something called cannabis hyperemesis syndrome. It does potentially cross the placenta, so it's not something I recommend in women that are pregnant or breastfeeding. This keeps changing. This is up to date as of a few weeks ago. And more and more, most states in the United States now have some sort of medical cannabis program, like Pennsylvania has one, but most states do. And then in other states, there's also, you can buy recreational, or you will be able to buy recreational marijuana. Some of you who might live in places like New York or New Jersey might say, well, what kind of, wait a second, I live in New Jersey. I can't buy medical marijuana. There's no dispensary where I can just buy it. These are often states where it's been approved, but that the state has not yet set up a dispensary system yet. So, so the green states like Pennsylvania, Ohio, West Virginia, Florida, those are places where there is medical marijuana. There's a medical marijuana program. Other states are already allowing people to purchase but others will in the near future. For patients looking to get medical marijuana, you need to have a qualifying medical condition. This is a very big list. This is Pennsylvania's list, and a lot of this list, this is not based on necessarily what the best evidence is, but rather there's other factors such as, political and otherwise. But almost every state that has medical marijuana available does recognize severe or chronic pain as a potential reason to consider medical marijuana. Some states like New Jersey actually has migraine as an indication. So I suppose if you only have, if you only have migraine once or twice a month and you can just take over-the-counter medicine, probably not something you would need to get qualified for. But, in some states, just simply having any kind of migraine is enough to qualify for medical marijuana. So the certification process there's some differences from state to state, but in most states you register for the program, and then a provider like myself will certify you for medical marijuana. There'll be fees involved with getting a license and getting your ID. And then you can visit a dispensary. That's pretty straightforward. So there's usually the three-step process of registering, certification, and at that visit, hopefully you're having a discussion about medical marijuana and why to consider it and how to use it. And then you're going to dispensary, and in most states you're able to go to any dispensary you'd like in that state. But some states do have the ability, they will allow you to use medical marijuana in their state, such as California. Other states do not. So even if let's say your medical marijuana in New Jersey, now you take it to Pennsylvania, that's crossing state lines. So you're subject to sort of the federal regulations at this point. The federal government has said that they will not prosecute or interfere with states that have medical marijuana programs, but of course there may be, I assume in the next few years, medical marijuana will be legalized nationwide, just based on the fact that very few people most all groups under age 70 now support legalization of marijuana. So I think it's only a matter of time. For recreational marijuana, and if you live in a state such as California or Colorado, you're able to buy up to 1 ounce, which is actually quite a lot, with an ID if you're over 21. And in some states that allow sharing marijuana or allow growing it at home in states that don't yet have dispensaries like Virginia, New York, New Jersey. So this continues to evolve. And most medical marijuana dispensaries, they're run like a business. So just like anything else, businesses can say, well, we're going to go where all the people are. So in a state like Pennsylvania, there's a lot more dispensaries in Philadelphia and Pittsburgh and Harrisburg than there are in other parts of the state. So they're run very much like a business. Many of you may be familiar with different types of marijuana. There's, of course, the flower where you can use a joint or smoke marijuana. That tends to cause some problems with lung problems. So if you have asthma, definitely not something I would recommend. Vaping is another option for patients. Most dispensaries have that as an option. It can be slightly more expensive. Our patients with who use medical marijuana for migraine tend to often like the tinctures. They're a little bit more expensive, but you do have a lot of control of how much you use. Um, and they're relatively rapid acting. So this is a potentially good option for patients with migraine, and also does not have the odor if you find the odor of medical marijuana to be bothersome. There are oral forms of capsules, and you can, of course, have edible marijuana. I typically do not recommend these, especially for someone who's trying to treat acute migraine. They take a while to work. They take many hours to work. So if you're trying to treat an acute migraine and you take an edible, that may not go so well. There are also some nasal sprays available, again, not as commonly used, a little bit more expensive. And then, of course, there's topical forms of marijuana. Again, not something I recommend a whole lot, but if someone is going to a dispensary, I usually do not say that they could not consider using topical if that's something they prefer to use that way. There's even rectal suppositories or vaginal suppositories for pain as well for patients who should need them. And when you go to the dispensary, you'll see a large amount of products. It's kind of like going to the Cheesecake Factory, and there's whole page of flowers and cartridges for vaping and tinctures and oral forms. And it's kind of, I call it like the Cheesecake Factory. You see there's 12 different types of paninis, and what's a panini? And you'll see that there's so many options, and it can be a little bit intimidating. So when it comes to the evidence, again, the best evidence is for chronic pain in adults. Fibromyalgia and nerve pain is also, there's some evidence for that as well, but there's no controlled trials for migraine yet. There are a few retrospective, these database studies where people will report their outcomes in their clinic, and those do exist. And I do tell people that it's not necessarily better than what's available. So, the number, if you give 3 people, for example, 4 to 5 patients gabapentin or some other medication for migraine, maybe one will have an excellent result, right? And marijuana is not that much different for most pain disorders. Maybe 1 out of 3, 1 out of 4 will have a really good result. And other patients will get somewhat better or maybe have side effects, but they're not necessarily better for everybody. So what do I do when I see someone for medical marijuana certification? What are some of the things I think about? First of all, is it likely to help? Is this someone where this could be helpful for them? And are they on effective therapy? So if someone is happy with their medications and has a good, plan overall, it would not be something I would consider just to add something to the mix. Again, if there's really not the significant disability, I would not necessarily recommend it. I ask patients to think about, is this just something you would take every day, multiple times a day, as almost a way to prevent migraine? Or would this just be something you take when you have a really severe migraine? It matters a lot in that if you use it every day, it obviously is more expensive. Marijuana is not covered by insurance. So I at least want people to think about those things before they go to the dispensary. Do they have a job? Are they a pilot or a truck driver and they won't be able to get it? Is it going to be way too expensive for them? Is there some issue with their family? They worry about their teenage child using the marijuana. They wouldn't be able to keep it away. Are they planning to become pregnant? Maybe not the best option. And even though marijuana in general has a relatively low rate of addiction compared to things like tobacco or opioids, things like that, there are some risks. And so if someone has a strong personal or family history of substance abuse, I do, provide some education about that, and may, in some cases, will decide not to go forward. So when I'm talking about it with patients with migraine, I mention it for patients who need a rescue medication, especially if you can't take other medicines or they're not effective for you. And if someone wants to use it for prevention, I do recommend that they would really need to use at least twice or even 3 times a day to get the best results. The marijuana is not designed, and these formulas are not designed to work very quickly, for very long. So again, this is not, if someone is only going to say I can only take it once a day, maybe I would consider using something else. again, only for patients who've had some disability or impact. And I like that they know, I know the patient. And we do ask everybody to sign a contract about how to use medical marijuana. It's just for you. It's not to share with your friends or, anything like that. If it's medical marijuana, it really should just be for you. I usually do recommend patients to start with a non-oral formulation. Again, the oral formulations do take a while to work. And sometimes they actually are more likely to be misused. And you take that brownie, marijuana brownie, you take one brownie, an hour later, you're like, I don't notice anything. You take another one, and now 3 hours later, you're feeling really sick. And again, if someone's on chronic opioids, there does seem to be some evidence that, it may reduce the amount of opioids. But if someone is saying, I'm going to just suddenly stop these high doses of opioids and just use marijuana, that may not go so well. So usually you have to have a conversation and say, this is not going to prevent withdrawal from opioids. Again, we don't tend to use opioids for migraine, but again, if someone who's hoping to switch to medical marijuana, it is different. And usually we're starting with low doses, and I sometimes will suggest using a 1-to-1 ratio of THC to CBD to start. Using small amounts, whatever you buy, you can't bring it back and ask for a refund. And I mentioned the tinctures as a potential option for patients with migraine. So we've actually gone back and looked at our patients. So in so far, what we found is that with appropriate counseling and using the advice of the dispensaries when they go, we have a lot of patients, almost all of our patients who we certify for medical marijuana have either severe headache or daily headache or migraine more days than not. And a lot of the patients who we started on have had other issues like insomnia or anxiety. And we have people that are using it every day. Well, some people just use it a few days a week. Most people do use some kind of inhaled form. Vaping is very common. And there's definitely side effects that we've had. I mean, the fatigue and feeling tired is probably the most bothersome for patients. But in general, most of our patients who've used it, a lot of them will have been able to reduce the number of acute pain medications they take for migraine, whether it be non-steroidals or triptans, things like that. It does seem, at least for some of our patients with anxiety, to really help, and patients who are using it for sleep. And I think we found that it has, in some cases, significantly improved quality of life. And we want to see that it's helping. So again, just like any other drug, if you take for any kind of medication for migraine, if you don't find it to be helpful, that's okay. We'll move on. You don't have to keep taking it. I don't think you need to use medical marijuana for months and months. Some patients have taken a while to find a regimen that works best for them. But in general, you should not feel bad if you don't do well with it. It's not like this is again, it's only for patients who have some severe disorder or significant impact, but don't feel bad if you don't do well. So, so right now, I think this better understanding the cannabinoids in our body and how they work and when you can use it, this has a lot of potential. Right now, there's a lot of trial and error. Let's just see if this works. And my patients don't know how many milligrams do I take? How much do I need? And we need to do a certification. There's not a lot of evidence for headache. Insurance doesn't cover medical marijuana. A lot of patients have side effects, but you can see a day where this is just part of medical practice, and that all doctors will need to know something about medical marijuana and be able to recommend it. And we'll be able to say, hey, you're someone who will really benefit from marijuana and should really do it, as opposed to, well, let's give it a try. And that we'll be able to have better ideas about specific formulations for migraine potentially, or other pain, and maybe even ways to enhance our own endocannabinoid system for pain relief. So this is a really exciting field, and I'm excited that you have had me on to talk about it. And I see that there's a few questions. So with that, I'll stop.
Great. Thank you so much. It's definitely an up and coming topic and very interesting. I will start. I'll start with the last question. Someone said, what precipitated your change in view about medical cannabis, and I'm not going to say that you did, but they
Okay.
said your opening statement made me think that you previously disapproved.
Absolutely. Well, first of all, bias. In medical school, when I was in medical school, very little knowledge about marijuana. It doesn't work. Don't bother with it. I didn't. I didn't have a lot of friends that used marijuana at all. Through college and medical school. The only time was I was in the Peace Corps. I did have some friends that used marijuana then, so I may be a little bit atypical. And I think learning about it, I have one of my mentors, Steve Silverstein, has actually done a lot of research in medical marijuana, learning about it and its role in pain, and having a chance to read up about it and learning that there's something to it, and also just we've had some positive patient experiences too. So I think that those are all things that it's important to keep an open mind. If you treat patients with migraine, you need to be open minded. You need to be able to change your mind. If you're just doing the same thing for years and years and you don't change your practice and change what you do, you're going to be left behind.
Great point. That's so true. Because I think my doctor might have changed his mind a little bit too.
Right.
um, okay, I have a medical card. Sorry, I have to get closer to my screen to read this. I apologize, everyone. I have a medical card and have used chocolate on the onset of migraine. While during the experience with having the chocolate, the migraine seemed to be okay and go away. But after it wore off, the migraine came back. It seems full blown. Does that mean they used the wrong source chocolate, or should they try something else? What
I,
does
I usually, so this would be an edible form. Like I said, I don't really love edible formulations for acute migraine because they take longer to work. So I tend not to go with that. I know some people like that it's not, it's not as, doesn't have the bad taste or the odor. But it's probably not my number one recommendation, especially because of the oral. Obviously nausea and vomiting, and how it affects how your liver metabolizes it. All those things could be important. So I'm not a big. I usually don't recommend the edible forms for migraine, but I think also you could look at it like the experience. It was similar to patients. If you had said the same thing about taking ibuprofen or sumatriptan, I took sumatriptan and it worked when it wore off, and maybe it was just a really bad migraine, really severe migraine that probably most things would have not been that effective. In most cases with with acute use of marijuana, certainly if it helps, but it's wearing off or it's not working, you can use more. It's not a problem to use to use another. But again, I would consider at least thinking about a non-oral formulation for acute migraine. Some people use the oral forms is like, I'll take this before I go to bed, it helps me with sleep and pain at night. That might be more effective.
Gotcha. Okay, great. Thank you. Do you recommend oil or alcohol-based tincture?
Good question. I actually usually recommend the oil-based ones, but this is something when it comes to the specifics, I usually defer to the dispensaries who, have a little more knowledge about it for a lot of our patients. So I actually tend not to make a lot of very specific recommendations about formulations. And in some cases, there's not a lot of differences from formulation to formulation.
Okay, great. Thank you. Um, what are your thoughts about cannabis and the effects on the SHT2A serotonin receptor?
Yeah, I don't know that the effects are enough to. The question is, it does affect serotonin receptors. Is it enough to be relevant, right? So, is it enough? Because we don't recommend it for, say, depression, for example. So, we have not seen reports of marijuana causing serotonin syndrome, for example. So I'm not sure if it's relevant. I think that there's, cannabinoids don't just act on, there's a lot of other effects besides their effect on cannabinoid receptors. But I usually tell people not to worry about it. So I have patients who are on antidepressants, who've used marijuana and have had no issues. So the 2A receptor is very important in terms of how antidepressants work, for example.
Okay, great. Someone had a question about CBD. You had mentioned something about CBD and save your money. Is there a place to actually purchase CBD, that a good place to purchase CBD?
You mean CBD product that is not with a
That-
dispensary, just plain CBD? No, because
Right.
I think of some of the comments, someone who said that I've used CBD with indica and things like that, and yeah, that's definitely is effective. So if
Okay.
you use CBD with medical marijuana, so again, it's a little complicated, but some people would say, well, if sometimes you might find that you go to the dispensary and you can't find. I might tell people like, well, I'd recommend like a 1-to-1 ratio,
Okay.
and you go to the dispensary and you're like, oh, they actually don't have anything like that. So I've had some people say, could I use, if I find something with like a 2-to-1 ratio, could I use CBD to kind of get to the like a over the counter kind of CBD to kind of get to that 1-to-1 ratio? Very complicated. I wish I could recommend how to do that, but
Yeah.
it makes a lot of sense. But how would you do that is sort of a trickier question. But it does make sense to say, hey, if I'm using just marijuana without really much CBD, because you would potentially get more of an effect from it that way. It may be more effective actually.
Okay. And it was more like the CBD you were talking about that you just see maybe at Walgreens, and you see
Yeah,
something
right.
that's
I
CBD.
so I think that also that the other problem with this sort of over the counter stuff is it's not well regulated, and this is a problem with supplements in general. The Walgreens brand magnesium may be very different than the CVS brand magnesium. We run into this problem all the time with supplements, is that they're not very well regulated in terms of their content, and when they've done studies, they've found that to be the case. So unfortunately, we're still a lot of this is still kind of trial and error. The other thing about recreational marijuana, it's not necessarily as well regulated in terms of knowing what's in the product. The other thing is that there is the taxes for recreational marijuana will be pretty high. In Colorado, I believe it's 40% of what you pay for is just tax.
Oh,
So
wow.
I do recommend patients who are interested in are using marijuana for pain or migraine to go ahead and get the medical certification, even in states where there is recreational marijuana available.
Gotcha. Okay, wonderful. Well, thank you so much. So we have to move on. There are a lot of questions there that maybe he can answer on the side while we move on, but I appreciate it. Awesome information, and thank you so much.
Thank you. I'll answer the questions now.
Okay, great. So to finish